Hey everybody, I'm here with my skeleton buddy here to talk to you today about chronic hamstring tendinitis, tendinosis, or tendinopathy. To me, if it has the word chronic in front of it, it's kind of all in the same bucket. I'm going to start out today's video with a story. I'm making this video because I have a lot of runners who are very tied to their hamstring problems. And for me as a provider, it's very frustrating to watch because if there's somebody who's very fixated on it being a hamstring specific injury and they're not really willing to look at the fact that maybe there's some other factors involved, it makes recovery a lot harder because first of all, you have to get the patient into the right mindset to recover. And then second of all, it also means that they're not going to do the work that they need to do to get better. So we're going to go through a story of one of the patients that one of the people, runners that I've talked to about this recently. So I had a runner friend come to me and ask me what they could do for their chronic hamstring tendinosis. They've had this for about a year and a half, and it gets worse with the faster days, and the easier days aren't quite as bad with running. But they also have been running for many years, and they feel like just the amount of volume of running that they've been doing has led to an overuse hamstring tendinopathy or tendinosis. And we're going to go ahead and demonstrate kind of like the area that we're talking about here. So we're talking about pain in the back of the leg here, kind of like starting from below the glute going down to the back of the knee. So this region here is what we're going to be talking about. I'm going to use the dark green band to show that. Right where the dark green band starts and ends here around the knee. So that's kind of the region of interest. Well, my bands aren't cooperating today. So anyways, that's kind of the region of interest that we're talking about. And this runner, she's been working with, she's seen a couple orthopedic doctors. She's, seen some physical therapists. There's one that she was, pretty attached to. Another runner that I'd seen had seen several different chiros that had diagnosed her with that, and they'd done a lot of soft tissue. But she kept having that issue. And what both of these different runners had in common was that they also had issues in other areas of their body too. So the first runner that I was talking about, she also had some kind of stiffness in the front of the hip and, tightness in the front of the hip and down to the quads. And the second runner had glute pain, hamstring pain down to here, and then was starting to have knee and calf pain as well. Both of them, the second one had a history of back injuries and also a very stiff lower back. And the second one was like, oh yeah, my back sometimes feels stiff, but it's, just normal stuff. And I'm getting kind of older, so it's normal. And I'm getting kind of older, so it's normal that my hamstring should be tired after all this mileage. I'm probably just too old to be doing this much anyways. So to me, I want to break that down a little bit more. So I'm just going to come out and say it. If you have all these different issues, you need to look at the fact that the hamstring is not the issue. It's just the alarm bell telling you that you have a problem that needs to be addressed. And there's several different areas that we could go with other underlying issues that could be causing this hamstring pain. So I'm just going to start with a few, but I'm going to be honest with you. A lot of times, if you have a hamstring issue, it is not going to take a year and a half to get better. It shouldn't take a year. It shouldn't take 6 months. Unless you're somebody who is doing extremely powerful, explosive movements, quick movements, or things where you're undergoing a lot of high load, where you're putting direct stress onto that tendon, you are not going to be just by going out there and running a slow, easy 10-mile long run. If you've been doing it for that many years, that's not going to just cause you to have a hamstring tendon issue. It doesn't work like that. The hamstring tendons are very strong, as are the hamstring muscles. And if you've been doing this activity for like that many years of your life without an injury, it's probably not the hamstring tendon. So let's go over some things that it probably could be. And you know what, maybe you're right, and maybe it's all these years of running that are causing you the issue, but it's probably not affecting the tendon. It's probably affecting another area that's a little bit more susceptible to overuse or chronic stress and like chronic loading issues. And we'll talk about that, a couple of those areas right now. So I want to start at the top and kind of go top to bottom with this. I want to start at the spine first, and let's talk about the fact that you actually can have hamstring issues from having a back issue. So if you're somebody who has a tight back and tight hamstrings, you should consider looking here first before looking here. A lot of times people have issues that start top and go down in the body. And this is the same for neck injuries or shoulder issues or hamstrings or whatever, you name it. A lot of times you gotta look somewhere more central first. And then you gotta make sure that's not the issue before you go to something a little bit more local or right on the spot. So we gotta look at the low back, and there's a disc here. We'll point to the discs. The disc here can actually refer directly to any of the regions of the hip. So a disc can refer to the front of the hip, it can refer to the groin, and it can refer back. The disc will not refer down below the leg or below the knee. It'll stay here to here, and if you have symptoms that are, hamstring and going all the way down, or hamstring down the back of the knee and going into the calf, that's not disc related in terms of it being a primary disc. Like the disc itself is not referring down to there, but it could be that the disc is injured and it's hitting on one of the nerves right here that comes out. These little yellow guys right here, they'll kind of come out of the spine and they'll run down in the front, the sides, and the back of the leg, including right along the path of the hamstring muscles, even into the back of the knee here, right where the hamstrings run. And we'll have some offshoots of nerves that run down in those areas too. And the fun fact is that nerves are kind of like ropes. So if you pull on one area, you pull on the other side too. So if you're pulling on the top, it's going to stretch and put tension on a nerve. And nerves don't like to be stretched. They don't like tension. So we're going to go over a couple tests later that can kind of allow you to test and see if it's a nerve tension issue or if it's really your hamstring. So this, going back to the back, so it could be a low back disc, it could be a nerve here that's causing the injury to the hamstring or causing that hamstring type pain. And yes, this can happen even if you don't have back pain. If it's the nerve type thing, you probably won't have local back pain. It'll just be right here. If it's the disc injury, you'll probably have some back stiffness, but it won't feel like a back injury. And we can have discs are something that respond to low-level stresses and kind of build up over time, as do disc-related nerve issues or even primary nerve issues. A lot of times runners will have hamstring pain because their S1 nerve, which runs right here and down the back of the leg, will have pain because they've been putting themselves repeatedly in positions that hurt the nerves while running and in an uncontrolled fashion. So it's not a problem to go through all of these ranges of motion with running in your hips and back. It is a problem though if your muscles aren't controlling those motions and don't know how to properly control those motions, so that you end up hurting those structures. And so the force that goes through your body is directly impacting a disc or a nerve or something like that. So the issue is not necessarily just strength, it's control, and it's making sure that the muscles are doing what they're supposed to do at the right time. So those things, those two structures are the structures, first up top structures that I want to go to. And now we're also going to talk about, everyone's favorite compensatory patterns and, hip loading in general. So the first runner that I was talking about, the one that's like, oh, maybe I'm just, too old to be running this much, and that's why I have this chronic hamstring issue. She was also mentioning that she had some hip stiffness in the front of her hip and mentioned that stretching her hip would make her hamstring feel better. And for me, my question would be, well, if it's the hamstring tendon, which is down here, why would stretching this make this feel better? So I have a couple answers for that. First of all, sometimes there's some stretches that can actually, some stretches for the front of the hip that can actually be relieving for the low back because it puts the low back in a happy position for the discs or the nerves and allows them to kind of relieve some pressure. So that's one answer. But also, sometimes runners will load really, really hard into the quads and will be very quad dominant. And so their hamstrings are just very weak and kind of being pulled along for the ride as the quads are loaded. And that also means that you don't have a lot of hip stability or hip strength. So it could be that you just don't have a lot of hip stability or hip strength. So when you do like hip specific mobilizing, it'll make your hamstrings feel better because you're starting to kind of share the load a little bit, or allowing your hips to be a little bit more mobile instead of just kind of loading straight into the quads like you would do in like a lunge. You know, there's definitely those runners out there that are here and not here and don't push off adequately or have a lot of hip extension. So that's hip extensions, this backward movement of the leg like this. So for the people that don't have a lot of hip extension, they're most likely loading a lot into the quads, and that can be causing hip pain as well as back and hamstring pain. So it's possible that you have a local loading issue or you have a hip issue, and that's why your hamstring's feeling better when you stretch the hip or something like that, or load the hip. The thing is if you're just doing stretches and mobility exercises for the hip, you have to remember that if you're a runner or you're an active person, or if you're a person who moves around through life with loads at all, which means grocery bags, backpacks, kids, dogs, whatever it is, your body has to be able to move forces and weights and loads that are outside your body weight. Especially if you're running or walking or doing any physical activity, you're being asked to move forces that are larger than your body weight. So if you're just doing stretches and mobility, you're just doing, you know, this kind of stuff, or you're doing this kind of stuff, or, you know, stretching your hamstring like this, you're missing out on a lot of different things that you need to be doing to make your body feel safe to move. Mobility is important, but you need a stable platform to be mobile on top of. So you need stability on top, or as a base layer for mobility to grow on top of. Your body's not going to want to move your hips around a lot if it doesn't feel strong and safe moving in those different ranges of motion. So you have to get strong and safe moving in those ranges of motion, and then add the mobility on top of it or alongside it. The mobility may work for a little bit, but if it's not working for you long term, then it's not a good fix for you. Same with soft tissue. That'll help a lot with mobility, and it's a really powerful tool to do a lot of massage work into the hamstrings. But if you're not addressing any of the root issues like hip specific issues, loading issues, if it's coming from the low back or the hip joint or something like that, you're not going to be really going to be able to get super far with the soft tissue or the mobility work. That stuff's going to help you, but it's going to be short term. And that's the whole point of this video, is to explain that if you're having those issues, if you're having a true hamstring tendon injury, it should be short term. It shouldn't be like a long term, I have to stretch for a year and a half, otherwise I can't do anything. And the other thing that tells me that it's probably not a hamstring tendinitis or tendinopathy or tendinosis is if you have pain, if you don't have pain when you're running slow, or conversely, if you do have pain when you're running slow and not when fast, or vice versa, like if the speed impacts how this feels, it's probably not that. If the time of day impacts how this feels, it's probably not a hamstring tendon injury, because if your hamstring tendon is injured, yes, you have a little bit more blood flow later on in the day, but you still have enough blood flow to move around earlier in the day, so you're still getting blood flow to that area. So it's not like oh, my hamstring tendon just need to warm up and get more blood flow, and then it'll stop hurting. It's like, no, if it hurts in the morning, then it's probably not your hamstring tendon. There's a lot of other structures that are going to hurt in the morning, and that's a video for another time. But basically, if it hurts in the morning, or if it hurts at specific times of the day, or if it hurts with specific exercise intensities, easier or harder, your hamstring tendon should hurt regardless of what load you put under it if it's truly injured or if you have a tear there. So basically what I'm saying is, if running is gonna hurt you, it should hurt you slow or fast. It shouldn't be this like middle and in between, and it should hurt, all the time. It wouldn't just be something that was once in a while it would hurt. So that's kind of where I'm coming from on that one. I have just so much more to kind of share about this topic, but I think I'm gonna need to break it up into a couple videos. So we're gonna stay here for right now and then talk about, or in terms of causes, but we're gonna also talk about what tests you can do to see if it's a hamstring issue. So I'll do the basic hamstring stretch that everybody does real quick to kind of demonstrate why this isn't really a good stretch or test. So when you're bending this way and you're just gonna kind of bend down and reach for your hamstrings or reach for the floor to stretch your hamstrings, you're also putting, this is basically a version of a clinical test that we do with new patients, like, you know, across the country. PTs and chiros will do a straight leg raise, which is essentially a hamstring stretch that you do on the table with your patients. So if your back is rounding and you're going like this, you're putting extreme stress on your low back, and then also with your legs like this in this position, knees locked and toes up, you're actually putting also extreme strain on the very nerve that you want to make sure is not the cause of the problem. So if this hurts you, it's not necessarily a hamstring. It could be a disc or a nerve still too. And so also, we want to make sure that we take those out of the equation. So one of the ways that you can do that is to not use your back, kind of push your hips back like this, bend your knees, and then reach for the ground that same way, and you'll still feel a nice little stretch into your hamstrings, and that would still irritate your hamstrings if they were the problem. So that's a way that you can kind of stretch the hamstrings and also test to see, because if the hamstring tendon or the muscle itself is injured, it won't like the stretch. So you can try that. Also, you would want to load the hamstrings too. So doing any kind of hamstring curl or something like that would hurt the muscle. If it's anything to do with bending forward and it hurts your hamstring, it's probably not a hamstring. Let's see, what are some other good ones for that one? So for instance, if you want to have somebody kind of like hold your shins down and you do like a loaded hamstring curl. So you can try this test real quick. Have somebody hold your shins down, so you're just using hamstring, and you're just gonna go ahead and lean forward and slowly come to the ground and then stop. And then you can go ahead and see if that hurts. And if it hurts on the way down and you feel that same pain that you get in your hamstrings, then it's probably a hamstring issue because you're putting a stretch load on the hamstring, but you're taking the back out of the equation. Thank you, Don. And other things that I would say to try would be anything that would directly load the hamstring that doesn't involve using the back or rounding the back. So, you know, if you want to pick your hip up and kick the wall and push through the hamstring, that should hurt. If you kind of bring your leg back like this or bring your knee up towards this, if you bend your knee and bring your heel up towards the butt, that's using the hamstring, and that should hurt you. And if it doesn't, then it's probably not the hamstring. Also, you could do that in a resisted format if you feel like that's too easy for you. You can put a band around your leg and have somebody resist you as you go up or go down. And that'll kind of also load the hamstring directly and rule out those other causes. But like I said, any test you do cannot involve using the low back, rounding the low back. It has to just take into account just the muscle. So that's why you want to have somebody either put a resistance band and allow you to kind of bend and straighten the knee, or have somebody push against you as you pull your heel to your butt. So lay on the ground, pull your heel to your butt like this, and have somebody pull that way away from you. Kind of like this. I'm going to try to self-demo this one. So ideally you'd have somebody pulling the direction that this band is.